So the first and the most obvious one is that we urgently need treatments which work in patients with COVID-19. Most of the effort to date has focused upon treating patients with more severe disease, so that's patients who have been admitted to hospital, and there are a number of clinical trials with a range of different interventions underway at present. The first results are starting to come through from some of these studies, and obviously the most important thing we need to know for our patients is which treatment should be given to which patient. There is a critical role for all doctors and other research support staff to play in this, because the quicker we can enrol patients into studies, the faster we will get these answers, and they will immediately feed through into the way that we care for our patients. So that's the short-term element, but there's a longer-term element here as well. We do not yet know what the consequences of having had severe COVID-19 infection are, but there is anecdotal information to suggest that many patients who have had severe disease, perhaps severe enough to warrant admission to a critical care unit, may be left with either long-standing lung damage or other problems as well. But we don't know the extent of these, and we don't know what treatment options might be available. So there will be an additional raft of studies coming along looking at the longer-term effects of COVID-19, most obviously in the lungs and perhaps on the cardiovascular system. But it's also important to think that there will be other consequences. I'm thinking, for example, in the mental health areas, which will also need to be addressed. So there's an immediate need to recruit patients into the intervention studies, but there's also a need to continue to follow up patients and recruit them into further longer-term follow-up studies, so that at the end of all of this, we'll have a much clearer idea of how best to manage patients with this disease.